So, welcome everyone to the second day of our virtual open house. And I think we were told to wait another minute maybe for people to join us. So, we will kind of wait a little bit until everyone has joined. So then again, a warm welcome to our second day of our virtual open house. Unfortunately, it's only a virtual open house this time and not a real open house, but we would like to give you a update on how our H2O Health Outcomes Observatory project is going. And Meni Styliadou has already done a great progress report at the session we had today. So we had yesterday. So we already had a half-day session yesterday, which was dedicated to our data governance model. And we have a second session today, which is dedicated to the progress we made in the project in the 3 disease areas. And we would like to talk with you and also with our expert panel here in this session about the benefit of a common language from healthcare providers and patients using PROs, patient-reported outcomes. So this is the overarching aim and topic of our second open house day today. And we will start with a short half an hour panel session with two very distinguished speakers. And then we will give you a more detailed report in the 3 disease areas, which is diabetes, inflammatory bowel disease, and cancer. And my name is Tanja Stamm. I'm from the Medical University of Vienna, and I'm also coordinating the Health Outcomes Observatory project on the public side. And together with us here in this first session are Søren Skovlund from Denmark and Stefan Larsen. And actually, I don't know where you are actually based in the world, Stefan, but I think you once came from Sweden, but you're probably at home in many countries. And I just will very briefly introduce you both, and then I will give a very short update also on the progress we made in H2O in the 3 disease areas. And I will then ask you for an initial statement, and then I think we will have a very interesting discussion on a few very important topics which are dedicated to PROs and patient involvement. Yeah, so both of you, I think, are very senior experts in the healthcare area, and we are very happy to have you also on our advisory board for the project. And Søren has worked with the Danish Ministry of Health and the Danish Health Data Authority, and you have worked on different universities, I think, and are a senior patient engagement officer and expert. And maybe you can say afterwards a few words about yourself. And likewise, Stefan Larsen, I think, is a very senior expert in healthcare. You have been a senior advisor in BCG, and also you're a fellow, and I'm very impressed about that, in the World Economic Forum, dedicated or in the task force which is dedicated on health and health economics. So I think we are very happy to have you both here in the session, but also in our advisory board. Yeah? From the perspective of H2O, the Health Outcomes Observatory project, and I have already said that Meni has reported lots of achievements that we have reached within the first 1.5 years. And I think we also have made a great progress in the 3 disease areas, which we kind of choose up front to look into. And we will report or give you a detailed report today, also in the subsequent sessions, on what has been achieved in the disease areas. And I think very much would like to thank all these disease teams for the great work that has been done. And we really reached a milestone in all the 3 areas. And that was actually to define what we want to measure. Because when we started our project, we really said that what's the first step, what is really needed is that we need to see what we should measure, and we have to define this together in a multidisciplinary approach. Yeah? So it cannot be just the experts, it cannot be just the authorities or only the patients say what should be measured, but we really need to consider these different perspectives. And we had a lot of collaboration with the outside world. So the idea is also not to do only an H2O kind of thing, but to really engage with experts in the area, experts on methods, on outcomes research or methodology, but also most importantly, disease experts. So people who are really in the clinics, who are treating patients, but also patients themselves. Yes. That's, I think, from our perspective, a really very important thing. And we would like to talk in this session a little bit about 3 different things. Yeah? First, why such a multi-stakeholder approach is important and why it was important to us, and why we should really include patients and also include what or measure what really matters to them. Secondly, I think we need to say that it's important that H2O should focus on implementation, and we have had a lot of discussions during the first part of the project, and I think it came very clear that we need to really focus on implementation because that's what is needed. And we need to collaborate with other organizations like ICHOM, for example, that you also represent, Stefan, in order to develop and further develop outcome sets, for example, also in the future and other disease areas. And I think we will focus on why such a collaboration is beneficial and necessary. And the third issue, what we would like to bring up is why it's important to really measure disease-specific issues, but also generic outcomes. Yeah? So these 3 areas we will target in our session. And I would like to start with asking you, Søren, about a first initial statement, and maybe you can also say a few words about yourself.
Okay. Thank you so much, and Tanya and the team. It's wonderful to be here. I've been looking very much forward to it, and I enjoyed the session yesterday as well, discussing all the challenges for implementation of these PROs. I have worked more than 20 years, all my professional life, basically, on trying to advance principles of person-centered care, people-centered care. A care model where there's a focus on the biopsychosocial understanding of the disease. There's a focus on the equal participation of patients and caregivers alongside the health professionals, working in a collaboration to achieve the best possible results. And I've worked internationally on utilizing patient-reported outcomes, quality of life assessments, as one of several tools to sort of bridge the gap of understanding that often exists between patients and clinicians in terms of what's important. So I find this headline of common language very, very inspiring, and a very nice way to talk about our shared goal, which is really to create better collaboration amongst all in the health system around lifting up the patient's voice to thereby provide better care. And of course, the other part of common language is the need to do this systematically for efficiency and so forth. So that was a little bit of an introduction on this part. And I can just say I have worked specifically in diabetes for many, many years, and now I'm in the wonderful situation to work across disease areas internationally on implementing patient engagement and clinical research. But I can see so many similarities between the challenges that we have had in the diabetes community and the challenges that exist in cancer and irritable bowel syndrome and other diseases. And the challenges have really been to create this unification across stakeholders about how we measure success, and what is the goal of care, and what is the right way to work together. It has been difficult in diabetes. We have struggled for many years, and we are still not there yet, but great progress has been made. And what we can see is that working from the principle of value-based healthcare, we are becoming very successful, I think, in really involving all stakeholders around one unified goal. So it's like this principle of shared accountability and clear goals. So instead of each working in silos towards own self-defined goals, we are bringing everyone together by agreeing on what matters. And the only way to get that unification is through the universal acknowledgement that the patients are the ones that are best suited to set direction on what we should try to achieve as a shared goal. So I'm sort of trying to answer several questions in one here, but that's sort of, I think, a key rationale and driving force, I think, for why multi-stakeholder approach, as is taken in the H2O, is so important and so vital to succeeding with the vision of making PROs like water, H2O in the healthcare system. I'll pass on to you, Stefan, or to you, Tanya.
Yes, thank you, Søren. That was great. And I think very important that you highlighted again the role of the patient, the important role of the patient. Yeah. So over to you, Stefan, for your initial statement.
Thank you, Tanya. Well, I've had the privilege of interacting with the H2O project from very early stages, and I find this idea of collaborating across many countries, defining standards, and then learning from the data that comes out extremely important. And my background is I'm a medical doctor and a scientist. I had planned to be a professor of pediatrics, but ended up 25 years ago of joining the Boston Consulting Group instead. And in that role, I've worked with all kinds of organizations in healthcare, from hospitals to governments to pharma companies and medtech companies and others. And one of the things that struck me quite early on was that across healthcare, a bit like Søren says, it's not specific for diabetes. Well, many of the challenges we see across diseases. And from research I've done under the past year, I would argue we have three big challenges in healthcare. One is what we call the value crisis, which is we're spending more and more, but we're not actually, many of our healthcare systems, getting more healthy life years out. In fact, in the UK, life expectancy is falling. It's falling also in the US. And we see that in spite of spending a lot more, we're not getting much more health out. And that's a big challenge that we need to face. Another one is an evidence crisis. We're actually not generating enough evidence for guidelines to help clinicians take decisions about who should have which treatment. And in fact, if you look at the data, we are generating less evidence relative to the complexity of clinical practice. So we have an evidence challenge. And the third one is we have a purpose challenge. The hospital clinicians, nurses, physiotherapists around the world are pushed increasingly to deliver more visits, shorter visit times, etc. We are speaking about healthcare as production units rather than health delivery units. And all three of these will only be addressed if we measure the results we achieve for patients. So outcomes measurement and transparency is the foundation for relevant evidence to focus management on the purpose of healthcare, which is to make people healthier, but also for us to be able to eliminate treatments that are not adding enough value to patients. And that's why the initiative of H2O, standardizing outcomes measurement across nations, is the only way in which we'll actually address the healthcare crisis. And I think the importance of outcomes measurements, there are measures that will be the same across diseases, quality of life measures, anxiety, and so on, but many are disease specific. And I think it's extremely important that we don't create only general questionnaires for diseases that are very different, because if we want to learn how to be better, we need to also to have disease specific measures. So the combination of generic measures that measure things that are common across many diseases and disease specific measures that will allow us to improve care, to choose which treatments are the right ones, etc. So I think that's very important. And I agree with Søren that the alignment of stakeholders, medtech companies, pharma companies, insurance companies, hospitals, they should celebrate successes against the same criteria. It shouldn't be possible to be a happy insurance company unless you've ensured that all the people you are insuring are actually measurably better in their health. It can't be only because you're more profitable. That doesn't make sense. That's not enough. You also need to make sure you deliver better health for the people you are responsible for. And there's a beauty in aligning all against the same measures, because then there will be new ways of collaborating or finding solutions, rather than having insurance companies, hospitals fight each other, or insurance companies and pharma companies fight each other. If they had the same goals, we would be a lot more innovative as systems. So that's why outcomes measurement and outcomes transparency is so important. I think I'll stop there. I could probably keep talking forever, but let me stop there.
Thank you, Stefan. No, I think that was very good and very concise and to the point. And thanks for reminding us also that it's really important to align across the different stakeholder groups. And I think this is also the reason why our project is a public-private partnership, and why we also think that the patients have a real important role in our project. And maybe Søren, can you comment a little bit from your perspective as an expert on person-centered care, how this actually resonates with what Stefan has said about the healthcare crisis, but also why we really need outcome measurement from this patient perspective, and also from the perspective of that we as providers would like to deliver person-centered care.
Yes, no, I think it's great comments, Stefan. And I think if we talk about the healthcare crisis, we all know that we need to find ways to create more health value for the resources we have available, to be more efficient. And health professionals want to be more efficient, and patients want to receive more health quality of life value from the health system with the resources that are available. And I think the notion of really understanding together, how do we make sure that we use the resources most effectively in the given situation, given the individual patient's needs, situation, and knowledge base? How do we ensure that the priorities are right? So I think that's what value-based healthcare can do, which is using outcomes measurement and bringing in science as a result of having standardized measurements to provide decision support alongside the patient's priorities, to say, this is what you need. I'm coming into the doctor with this condition at this stage. This is what should we focus on to get you the best possible help at this stage. And I think that's a way to deal with the health crisis, that we're creating that efficiency. So I think, and I think it's very interesting that we have worked for years in many diseases to establish clinical outcomes that people can agree on across countries. From the medical field, especially from medical science, clinical science, how do we measure blood sugars? How do we measure pain? How do we measure other biochemical indicators? Suddenly now we're faced with this wonderful and daunting challenge to create standards for how to measure something so intangible as well-being, quality of life, anxiety, and so forth. It's a difficult task, and we need to be humble to the disciplines that need to be involved in that. So there are some technical challenges to establishing that multi-stakeholder alignment on how to do that. But we have worked on it, perhaps in the shadows from many people's perspective, but we have worked on it for 20 plus years. Especially the pharmaceutical industry has generated an entire science body around how to psychometrically evaluate quality of life, as it has been a requirement in order to test clinical treatments and health technologies. And now we're moving from that into the health services, healthcare field, and really needing to establish something that balances all stakeholders and grasps all of it. And I think the H2O project is an example of trying to take the best from each stakeholder group, I think, and find a convergence point for this.
Can I make a comment, Søren, because I think you brought up, person-centered healthcare, and this is I think, a very important term. But I think there are probably many in the audience, at least I know many, who find it very confusing with, we have person-centered care, we have precision medicine, we have value-based healthcare. And in some discussions, I hear them being presented as opposites or different from each other. And I think it's very important to understand that they are not. They are, in fact, very much two sides of the same coin. So person-centered care, the way Søren describes it, is to allow a patient to make informed choices on the basis of predictions of side effects and effects and personal preferences. So if I have prostate cancer and need to have surgery, I may want to go to the opera every evening. So for me, incontinence would be really bad. And if I hear that they operate my prostate, I have a 50% chance of incontinence, I will probably say that's not a clinical procedure for me. I would rather have radiation, even if I live a bit shorter. I may have 1 year shorter life expectancy if I don't do surgery, but do radiology. That's person-centered care. It builds on the statistics that we can get, the data we can get if we have standardized outcome measurements. And that's why it's so important that we use standards for what to measure in as many clinical settings as possible, because only then can we build a statistical foundation for person-centered care, and we can help patients make informed choices about which treatment they want or which one they don't want. And today, we are much more at the mercy of what the urologist thinks or what somebody else thinks. You go to a radiologist, you will get irradiation. You go to a surgeon, you'll get surgery. But with the statistics that outcomes measurement standardized across large cohorts of patients will allow us to do, is to really give much more of a power to the patient. And I think that's really important to see. And that actually becomes also more precise medicine. We will be more accurate in predicting who should have which treatment. So it actually all comes together, but it all resides on outcomes measurement. It's a prerequisite for all. And I think that's very important to see and know.
Yeah, and that's exactly what we would like to do in the H2O project. And I see, Søren, that you want to comment. Just maybe before that, I would like to remind the audience that there is a possibility to ask questions in the Q&A tool, which you see on the bottom of your screen. So please take the opportunity and ask questions if you would like to do. And over to you, Søren.
Yeah, well, I would just say, Stefan, I really appreciate your point. It is important to emphasize that it's not either or. It is indeed both, and to look at it in that way, because I think that in order to achieve this standardization while it's important to also ensure that this collaborative aspect of care, where you really recognize the equity of patients and health professionals, and recognize that treatment is not only about medicine and technology, it's also about education, awareness, empathy, social support, so other aspects. So it's important to merge this patient-centered, person-centered model and with this standardization, and make sure that it works in practice as a person-centered framework. And I think so. I totally agree. It can be both, but I think the essence of that is to ensure that the standardization that we are striving towards for outcomes, that it has systematic involvement of patients in all the stages towards those standards. So the standardization is not done just focusing on the outcome, but focusing on the contextual application of these outcomes in practice. So we create that shared vision, and we create those tools that will allow that to happen, because we have had many standardized outcomes that have not generated a person-centered medicine necessarily. So it comes with this multidisciplinary approach, but totally agree.
And I think, just one comment to that, Tanya. I think it's extremely important when we speak about outcomes in these settings that we actually add a few words, which means outcomes that matter to patients.
Yeah, I agree.
Because outcome is one of these words like value. It can mean a ton of things. But I think if we focus on outcomes that matter to patients, we can't figure that out without talking to the patients. And if we measure a bunch of other outcomes, we need to ask ourselves, are they really important for patients or not? I mean, we have a healthcare system to deliver better health to patients, and therefore our focus has to be outcomes that matter to patients. So I always try to add those words to make sure that we're not talking about any outcomes. It is what matters to patients that we're aspiring to.
Yeah.
Yes, thank you. I think that's also a very important point. And we have just a few minutes left, and I have seen that there's a question in the was a question in the Q&A tool, and it resonates very much with what you have said earlier, Søren, about the other aspects of care. And the question that Erica had in the Q&A tool was, can the medical doctors do that all alone, or do we need also the team of the other health professionals here in order to deliver on the one side the standardized outcome measurement, but also the person-centered care?
Yeah, so I'd love to just give a first quick shot at that. I know the time is limited, we're just getting warmed up, but that's such a great question, because that actually, the answer to that illustrates the significance of this model as a multi-stakeholder model. Because as we define the outcome sets that define what matters, we learn that these outcome sets reflect both medical, psychological, educational, social factors of the disease. And as we then implement these PRO systems in the health setting, where each of the outcomes have actual actions and action plans and strategies attached that will ensure that the measurement results in value generated for the patients, then we realize that some of the PRO outcomes, some of the outcomes that matter actually are about social, some are about psychological, some are about biological, and some are about access and other factors. So the doctors cannot do this alone. The successful approach is that the PRO is a multidisciplinary concept and tool that is actually applicable across sectors. And that's the experience that I'm coming from Denmark, where we developed this model in diabetes and realized that working across primary and secondary sectors to establish a tool that actually is geared to work across all sectors from that systemic model that actually allows different parties to go in and utilize the tool, and recognizing that based on attribution analysis, the doctors are not responsible for all the outcomes. They are responsible for some of them, others are responsible for other parts of it. So you create this unified outcome assessment that works.
Yeah, thank you, Søren. Yeah, that was also an important perspective to think a little bit across the whole system, and maybe not only as when we come from hospitals only for in-hospital care, for example. There's one more question which actually is related to considering that we really need to engage patient, and Daniel has asked this, how many questions do you think patients will respond to? And maybe that's not so easy to answer, and it will depend probably on what we ask them and how often, and what's actually the disease and the complaints or symptoms of the patients are, and what they would like us as healthcare providers should do. But still, maybe a quick estimate of you both, and then we have to close the session, I think.
I don't know, I can start. I think they will answer as many questions as they are motivated to answer. So if you explain what this data will be used for, and when the patient comes to the clinical team, the data is used in the conversation, they will be motivated to answer questions. I have seen data from institutions who have 93% response rates on quite extensive surveys, but it's because the patients saw data from other patients when they came there. They understood that it was meaningful and valuable to improve care. So we can send 3 questions that have really bad response rate if we don't explain why it's important, and we can have much more if we handle it right. So I'm not going to give you a number, but I think very much is about motivating the patients to contribute so they understand why it's important.
Yes, that was a wise answer, and I think we heard that also yesterday, and that's also our experience. So one very last comment, Søren, and then we need to close our session.
I just want to say I completely agree. It was the same answer. I just wanted to add, it's actually